Welcome to our weekly national news conference. I'm Sandy Close, Director of Ethnic Media Services. Hello to everybody. It's great to see so many friends. Today, we welcome the nation's premier federal agency tasked with monitoring the nation's health, the Centers for Disease Control and Prevention, the CDC. We are honored to host the first of 3 briefings with leading CDC experts who will provide the latest information on the Covid-19 pandemic and the vaccine rollout. The CDC is providing the same information for our briefing as they are at a simultaneous White House briefing in Washington. Our first speaker is Dr. José Montero, Director of the Center for State, Tribal, Local, and Territorial Support, who will provide the overview. Our second speaker is Dr. Lauri Hicks, Chief Medical Officer of the Vaccine Task Force. Thank you so much to both of you for speaking to us today. Now I'm turning the conference over to today's moderator, Sunita Sarabji. Sunita.
Thank you. As Sandy mentioned, we are joined first by Dr. José Montero. He's the Director of the Center for State, Tribal, and Local and Territorial Support at the CDC. Dr. Montero, welcome.
Good afternoon, everybody. Good morning. It depends where in the country you are. I'm really great to be here, having this opportunity to talk with you. As said, I'm Dr. José Montero. I am the director of CDC's Center for State, Tribal, Local, and Territorial Support, which is the part of CDC that engages directly with the health departments across the country. I am really excited to speak with all of you today because I understand how integral you and your organizations are to this continued education and well-being of your communities. So let's dive in and discuss the state of the pandemic, the current state of the pandemic. It is clear to many of us that this is becoming a pandemic of the unvaccinated. People who are unvaccinated account for a majority of the new infections, hospitalizations, and deaths. I want to emphasize that people who are unvaccinated account for a majority of the new infections, hospitalizations, and deaths. We're seeing outbreaks of cases in different parts of the country, especially those that have low vaccination coverage, because unvaccinated people are at risk, and communities that are fully vaccinated are faring way better than those communities that aren't. If you want to look at our data in more detail, I invite you to go to our website. There is something called COVID Data Tracker in the CDC website, and you can see data in your state and by county. Those counties where we have seen the increases correspond quite often to counties with low vaccination rates. When we look over time, we can put these increasing cases in perspective. And certainly that is what we are observing today. So again, as part of this context, back in January, we had an average 200,000 cases per day. The entire country was in a high level of transmission. From January to June, it's clear that we made remarkable progress. The percent of counties with high transmission decreased. But as I have been trying to emphasize here, we have seen recent growth in cases in some counties. So, well, we have to recognize that we are in a far better position than we were in January, February, March, or even April. It is quite clear that this pandemic is not over. The good news is that if you are vaccinated, you have good protection against severe COVID-19 and hospitalization. And you are protected against the variants that are circulating today in the country, including the Delta variant. So let's talk a little bit about the Delta variant before turning this to my esteemed colleague, Dr. Hicks here. So I am sure that you have been reading in the papers that you write and in the articles that you have about the Delta variant. We know that it's spreading rapidly throughout the country. We know that this particular Delta variant has increased transmissibility. That basically means that it can spread easily between people and is currently surging in pockets of the country with low vaccination rates. As I mentioned as well, the data suggests that the current FDA authorized vaccines that we are using here in the US, the Pfizer and Moderna and the J&J, offer protection against Delta and other known variants of concern. But to talk in more detail about issues on the vaccine, I will pass this to Dr. Lauri Hicks. Dr. Hicks?
So thank you very much, Dr. Montero, and good afternoon, everyone, or good morning, depending upon where you are. My name is Dr. Lauri Hicks, and I'm the Chief Medical Officer for CDC's Vaccine Task Force. And in my role, I oversee our work on vaccine safety, our independent advisory committee that makes the vaccine recommendations, and our guidance for doctors. And as Dr. Montero just said, we're seeing increases in cases in areas where people are unvaccinated. So we really want to reiterate that this is where we're seeing the most cases, in those places where people are unvaccinated. And I want to spend some time with you today to reiterate the importance of getting fully vaccinated. According to CDC data on vaccine completion, the good news is an extraordinarily high percentage of people in the United States who've gotten either the Pfizer or the Moderna vaccine are getting both of their shots, about 90%. And that's even better than the completion rates we have seen for other vaccines that also require more than one dose, such as the hepatitis and the varicella or the shingles vaccines. But I want to reiterate that the Pfizer and Moderna vaccines are most effective when given as 2 shots in a series. Both vaccines provide effective protection after 2 weeks after the second dose, with each exceeding 90% effectiveness against illness, including severe disease, in the real world. Not completing the series puts those who are partially vaccinated at risk of illness, including the highly contagious Delta variant that Dr. Montero just spoke about. We know that getting vaccinated 3 or 4 weeks after your first vaccine may be difficult. But with the increased availability of vaccines nationwide, we really want to encourage people to get vaccinated on time. Additionally, it's important to know that you don't have to restart the series if you get your second dose late, even if it's after the recommended 3 or 4 weeks. So in other words, I've been saying to family members and friends, in other words, it's not too late to get your second dose to be considered fully vaccinated. Before we open the call for questions, I also want to direct you to CDC's COVID data tracker. Dr. Montero mentioned this as well. This data tracker has a wealth of data about how many people are getting vaccinated and some tips on how to interpret these data, especially the data on age, sex, and race and ethnicity. We know that certain communities, independent of geography, are also experiencing lower rates of vaccination. Although most racial and ethnic groups are demonstrating increases in vaccination, Black Americans continue to be under-vaccinated. We've added a new feature on the tracker that combines both vaccination data and social vulnerability indicators as measured by CDC's Social Vulnerability Index. Now, I wanted to just mention, when we talk about vulnerability, we're talking about things like gender, population, age, education, social and economic status, and access to medical care. So this map provides visualizations of how county-level vaccination coverage by county-level social vulnerability varies throughout the United States for the total population and also for different age groups. COVID-19 vaccination is our most effective strategy, without a doubt, to prevent infection and control the COVID-19 pandemic. We encourage you and the audiences that you reach to get vaccinated yourself, your family, and for your community. If you're not vaccinated yet, you remain at risk. We are going to continue to see preventable cases, hospitalizations, and sadly deaths among the unvaccinated. So if you haven't done so yet, now is the time to get vaccinated. Thank you very much.
Thank you to Dr. Hicks and Dr. Montero. Before we open the call up to questions from reporters, I'd like to ask a couple of questions of both of you. Dr. Montero, you talked about the surge in new cases. Do you believe that we are already in the midst of that third wave that was anticipated?
So I don't know if I want to categorize that as we stand in today, but it is absolutely clear that we are on the upswing of these of the numbers. We clearly see an increase in cases. We clearly see an increase in hospitalizations, and we're starting to see an increase in fatalities. Now, that is the data for the country. But if you start to look at this state by state, you are going to see big differences. So Dr. Hicks highlighted as well the COVID data tracker. Look at your own states, and you are going to see the differences across the different parts of the country. Time will tell us if we are in that wave or not. But clearly, we are at a place where we are going up, and we do have an amazing tool at our hand that will dramatically change that, and is the vaccine. We saw that early on. As soon as we started the vaccination, we saw the dramatic decreases in mortality in populations over 65, 75, where we started, and we have seen the change. We need to complete the task. We need our population to be vaccinated.
Could you characterize the metrics that might establish that third wave by the CDC?
Can you say that again? Sorry.
Could you characterize what might constitute a third wave? When will the CDC say we are in a third wave? What are the characteristics that would?
I don't have those indicators with me right here, but they are tied to a continued increase. Most of the time, the definition of we are in the third wave is done retrospectively. We see the trends. As I said, we know that we are going there. We still have an amazing tool that can help us change that and never get into it. We need to continue to talk about the vaccines.
Absolutely. In March of 2020, we understood that there were going to be health inequities in addressing our response to the pandemic. And I wonder, 18 months later, do you think that we have addressed those health inequities adequately? I asked this question to both Dr. Montero and Dr. Hicks. Dr. Hicks, you mentioned that Black Americans still continue to be under-vaccinated. So perhaps you could start?
Sure. So I think one thing that we really need to do, and this is an area of focus for CDC right now, is ensuring access and equity in terms of getting vaccines into communities, making sure we're generating the demand for vaccine, and then also targeting those hotspots where we're seeing a lot of transmission. So key goals to expand to places where people can get vaccinated and shift to broad coverage, places like making sure that primary care physicians have access to the vaccine or able to deliver it, vaccines for children providers have them, school focus programs. We're really working also on increasing vaccine confidence and partnering with a number of different trusted advocates. We also know that providers are our patients' most trusted source of information on vaccines. So we want to make sure that providers have the information they need to educate patients. And also peer-to-peer promotion is another approach to try to reduce some of that hesitancy and reduce some of the inequities that we're seeing. And CDC is also working with a number of different medical associations, community clinics, faith-based organizations, really to get into those communities. And this includes support for the National Resource Center for Refugees, Immigrants, and Migrants. which is working closely with community partners to address COVID mitigation and vaccination efforts in that population.
So let me add a few things there. So in your question, if we are doing enough and if we have changed it, historical wrongdoings don't get corrected overnight. And it will take time for this country to be able to have us all in the same level at the same equity level that we will all aspire to. When we started the pandemic, we saw that some professions and some groups got hit harder. Those people who work in the one-to-one industries, service to the clients, or had work sites where they were all together. So industries in the agricultural field or some productions were presenting cases at higher levels. That's why we emphasize with many of those populations today, they need to vaccinate so we solve the issue. But at the same time, we are working with the health departments and across different parts of government to address many of the things that are behind that. There are issues of access, there are issues of education, there are issues of trust. And Dr. Hicks mentioned before how we have identified trusted messengers. We see that African-American groups or Hispanic groups are behind in vaccines, and they have, especially African-American populations, historical wrongdoings and reasons for trust that we cannot deny. But we have a pandemic. So we are not going to change all of that overnight. But we are certainly working, and CDC is developing right now a lot of science components on the science of disparities. Our director has been talking about a core initiative that is helping us all at CDC across all programs, because it doesn't apply only to COVID-19 to address disparities. In the center that I am the director, we put out 2.25 billions with a B. I know that in my accent, you may think that I said millions. No, I said billions with a B for social disparities in populations that have less access and have health inequities. That means that we're trying to reach out to rural populations, populations in the outskirts of the big cities that don't have the same level of access and care and have suffered historically some of these issues. So there are funds out there to make these changes. It will not happen overnight, but with the vaccine, our team, the Vaccine Task Force, is making an amazing work trying to reach out to those groups so we can protect them.
Fantastic. I would like to next ask my colleagues, Pilar Marrero and also Sandy Close, to ask a couple of questions. Pilar.
Yes, thank you, Sunita. Thank you both for being with us. And this question is for either of you or both who wants to answer it. A pandemic of the unvaccinated sounds like mostly it's the unvaccinated who are affected, but this isn't true, is it? The reality is that unvaccinated people are creating the new infections, the new surge. They are likely to create more variants for the rest of us who are vaccinated and who may actually have breakthrough infections thanks to them. So why aren't we saying that? Why aren't we saying the unvaccinated people are not only affecting themselves, they're putting everyone else and all the gains that we've done in peril?
Thank you very much for that comment. You are absolutely correct. It was never our intent or my intent when using that term to say that only unvaccinated people are getting sick or impacted. I think that I specifically said the majority of the cases currently are in that population. But you are highlighting the core issue is that it doesn't get restricted to people who feel that I am not going to be sick or I'm not going to be severely ill. From there is where it expands. And that is what is changing the dynamic in many counties around the country. So that's what I highlighted, that a few counties that were not at high risk are changing because they are they are the place where things spread out. And it worries us a lot that some segments of the population are unvaccinated because maybe in some groups, they are the ones who are going to have access to our elderly. They may be taking care of that elderly, and that is where we are going to see breakthrough cases. So you are correct in in rounding the term and the concept. So thank you for that.
And just to add to Dr. Montero's comments, I absolutely agree with everything he said. That there are certain populations who can't get vaccinated yet, right? So we have the under 12 population in the United States who can't get vaccinated yet. And so obviously our children remain vulnerable, especially if transmission is high. And so that is another population that I'm very concerned about. And appealing to parents, I think, is a really important step to try to make sure that they're getting vaccinated in order to protect their kids. And then the other part of this story that I think we need to be talking more about is the immunocompromised population. So even in those populations, even if they get vaccinated, may not have the same level of protection as someone else who's not immunocompromised, who's vaccinated. And so it's really up to us to figure out how do we protect these individuals who are at high risk for severe complications from COVID, even if they're trying to do the right thing and get vaccinated. And so making sure that the individuals that they're getting exposed to those individuals are getting vaccinated is a really important step. And then you may have seen that some organizations like the Society for Healthcare Epidemiology of America are moving forward with statements, very strong statements about vaccination of healthcare workers and making sure that a higher proportion of the individuals serving these vulnerable populations are getting vaccinated as well.
Henrietta Burrows. Henrietta.
Thanks so much, Sunita. Dr. Montero and Dr. Hicks, neither one of you has mentioned the wearing of masks, and yet it's been shown that masks can be a very important tool in preventing the transmission of the virus. So why is there no mention now by the CDC of wearing masks? Why has the CDC seemed to have pulled back from any reference to mask whatsoever?
Yeah, I think what we can, this is Lauri, I'm happy to start, and then Dr. Montero, if you want to add. I think that masks are extremely important, and preventive measures are still very important, particularly in those people I just spoke about. So children under the age of 12 who are unvaccinated, persons who are immunocompromised, who even if they have been vaccinated may not actually be fully protected against COVID-19. So I absolutely 100% agree with you that we have opportunities to still promote the other preventive measures as well. Masking is one of them, social distancing is another, making sure you're avoiding crowded places, especially indoor, poorly ventilated spaces. If you're unvaccinated is advised. In addition, some of us have decided that we still, even though we're fully vaccinated, have just chosen to continue those extra preventive measures. And I'm one of those people. When I go to the grocery store, I still wear my mask. And I think that message needs to get out there, that, the permissive recommendation to remove your mask is just that. If you want to remove your mask, it's considered safe to do so. But if you prefer to continue wearing a mask in places where you may be around unvaccinated individuals, that is absolutely, it's totally acceptable and your decision to do that. So I think we need to be a little bit more open in our discussions about masks and the opportunity for prevention.
Lauri, if I can build on what you just said, I am with you. I was vaccinated months ago, and when I go out, I put on my mask. I went to visit my mother in Colombia, and I use my mask all the time because the situation there is way different. And I want to highlight that part because what people may have not heard correctly in our recommendation about the mask is that it may be incumbent upon the local or state authorities based on the epidemiological situation on the region to recommend or mandate the mask use. CDC still has clear recommendations for masks in some settings. We are still talking about what happens in homeless shelters or correctional facilities. So the message is not black and white. And that has been one of the most complex things around this pandemic, that messages are not always black and white and that they evolve based on the stage of the pandemic where we are at. A year ago, we didn't have vaccines. Today we have them. We know that the vaccines are good, so we are protected. We can be around most people without any risk, but we can use the mask if we want to. If I live in some particular counties, I will use it all the time if I am outside because vaccination rates there may be 40% only, or things like that. And as Dr. Hicks mentioned, when we're talking about schools in our new guidance, we made some specific recommendations for some use of the mask there as appropriate under different circumstances. So please don't say that CDC says don't use masks, because we never said that. We said that with the vaccines that we have today in the US, those of us who are vaccinated have good level of protection, but the mask has a value in some particular settings, and local and state communities will be able to decide if, based on their epidemiology, they need to do something different.
Sunita, we better let people go, but thank you very, very much. It was just tremendous to have this opportunity to ask questions and share concerns and hear experts address them. Thank you.